Dan Klett, principal here at the high school. I'd like to introduce Jackie Rhew as our featured speaker tonight. Jackie is the co-founder of the Center for Emotional Wellness of the Northwest Suburbs. She has co-authored the Successful Parenting Workbook, Create Your Custom Plan for Raising an Independent Child into Adulthood. Jackie's expertise lies in a multitude of areas such as school refusal, eating disorders, self-injury, substance abuse, gaming addictions, grief issues, trauma, depression, and anxiety. She has been called upon by hundreds of school districts, both locally and internationally, for consulting staff in order to better serve the youth. Jackie serves as the clinical liaison for Amita Health, Alexian Brothers Behavioral Health Hospital in Hoffman Estates. She previously served as the assistant director for school anxiety and school refusal program. She is an expert in her field, specifically consulting with schools and family agencies and mental health hospitals, and we are honored to have her speak tonight. Please welcome Jackie Rhew.
Thank you, Dan. Thanks very much, everyone. And I know some of you are on our last call that we had, I think it was about a month ago, and we really talked about supporting our children and our students. And one of the conversation topics that came out of that, multiple parents requested more information on managing anxiety and supporting our teenagers, in particular, managing anxiety and dealing with anxiety. I am known in this area as a clinician that specializes in anxiety, and I've been treating it for the last 15 years and partnering with schools to help the educators and the parents support students during this time, especially dealing with stress and anxiety. So as we get started, if you have any questions or comments, feel free to use the chat feature. I want this to be helpful for you. I by no means feel like I know everything, and I'm constantly learning. But if you have certain things that you would like to have addressed or you'd like me to touch on, feel free to use the chat, and I will be monitoring that as well. As we go to the first slide, and this is being recorded tonight, and so you will have the information as well as the PowerPoint. I want to start off by just talking a little bit about stress versus anxiety and what's the difference. Some of you may have pens and paper handy. I'm going to ask you for a few moments just to take a moment and reflect on some of the stressors that you're dealing with in your life right now. And I think this is an important piece. And when I'm dealing with especially teenagers, one of the things I talk about with them is what are some of the stressors that you're experiencing in your life? What are some of those events or those people even that you find or that are triggering stress for you? Some examples of stress might be too much of a workload, conflict with somebody in our life, might be financial stress, it might be loss. The fact that maybe you're dealing with multiple roles right now, maybe you're in multiple roles, you're trying to be something different for each person. I want you just to take a moment to think about the stress that you're experiencing. And next, I want you to think about, how you manage that stress. What are ways that you deal with your stress? What are ways that you respond when you are in extremely stressful situations? And this is going to be important not only to be aware of this, but also to keep in mind how you're modeling stress management to your teenagers. Each individual is going to process stress differently. You might have two kids at home, and one child deals with stress in a totally different way than the other. And that can be based on the child's personality, the skills that they have to manage stress. It's truly going to look different for each child. So I wanted to start off by just talking a little bit about stress, because when we don't deal with our stress and when stress really becomes unbearable for us, then out of that, we may start to experience anxiety. And anxiety may come from prolonged stress that has not been dealt with. Not always, but sometimes. So I do want you to think for a little bit about your stress. And if you are under a lot of stress, and especially, and I shared this last session, I have two children myself. Now they're 21 and 22. But I will say, out of all my roles, the role that I've been most passionate about and the role that has triggered the most emotion from me and has at times exhausted me is the parenting role. And so for you tonight here, if you are experiencing a lot of stress, I want you to really focus on the self-care piece and know that you're doing the best you can. Every day is going to look different. Our kids are resilient. Their brains are forming. They're malleable. They experience stress differently than us. Try not to be hard on yourselves as parents or critical, but give yourself some grace that truly we're doing the best job we can. And so if you are experiencing a lot of stress, I want you to keep that in mind. And now we're going to talk a little bit about anxiety, but I want to start off by talking about new is uncomfortable. We face new situations every day, but for many of us, not having control over our situation, not having control over our environment, experiencing transitions and uncertainty is going to cause us a great deal of discomfort. Some of your students, some of your kids are dealing with a lot of uncertainty with school and with different elements in their life. And as they're transitioning to whether it's e-learning or in-person learning, it may be uncomfortable for them. I ask you, when you think about your children at home, and some of you may have younger children, I think many of you have teenagers. How do your teenagers feel that they do with handling new situations? Do your teenagers feel confident that they can manage a new situation? And if they don't feel confident that they can manage a new situation, why not? Why are your teenagers possibly doubting themselves and their ability to face new situations? And it's not a criticism, it's not a comment, but I think it's important. And this was really challenging for me as a parent. So often I had to keep in mind not to project my experience or my feelings on my child, but to recognize two people can have entirely different experiences. And as parents, just because we're really stressed and nervous about something doesn't mean that that's their experience. But so often I find that we project. So think about, for your child, if they don't feel confident, if they're really nervous about going to a new situation, help them through that, as opposed to, and I'm going to provide some tools and tips on that as well. What are healthy levels of stress? Now, this again is going to look different for each child and each teenager. What can they handle and what can they manage? You might have a teenager at home that you're really concerned isn't very motivated, and they're not doing a lot. They're not able to manage much at all. And you might have, on the reverse end, a teenager at home that, and I just talked to a couple kids this week that put so much pressure on themselves that they're constantly feeling like they're a failure if they're not achieving. And so we see both sides of the spectrum. But really coming into tune with what are healthy levels of stress. Where is that happy medium for your child? And again, I had two kids and they were about a year and a half apart, and they were totally different in terms of what they could manage. The younger child tended to thrive in really being busy and highly stimulated and doing a lot. She just fed off that, where my older child did better when it was more low key. She tended to need more breaks and would become stressed a little bit more easily. I'm kind of giving this as an intro before we go into the anxiety section, but the next tip is just thinking about the difference between success versus perfection. I find that my clients that struggle with anxiety and stress so often struggle with setting realistic expectations. They struggle going into situations and having those realistic expectations. That's why you will hear me say, I never say to a teenager or a child, it's going to go great, everything's going to be wonderful, this transition back to school is going to be amazing, it's going to go well. I say, gosh, this could be really stressful for you. I get it. I want to hear what your thoughts are. How could you manage? What are you expecting this to look like? Because realistically, we have to be honest about what this might look like, and then let's problem solve and talk about ways we can manage if it is difficult. And I've been on the other side where I've been the one that's been catastrophizing. This is so terrible. This is awful. This isn't going to work. but I've learned that's not helpful. Let's move into kind of what are our expectations and how do we problem solve. And that's key for our kids. That's key for our kids in high school. That's key for our kids as they leave high school and they enter adulthood. Life is difficult, and we have to figure out different ways to problem solve and manage. Our realistic expectations are also going to come into play, where I find it's really important for our teenagers to be able to have a good understanding and be able to take a step back and assess their strengths and weaknesses. What are areas that I feel like I'm really strong in? And what are those areas that I need to work on? You will also hear me say to teenagers things like, what's something you really did well today and what's something you struggled with? Because I really want to embrace your successes as well as those times that you bounce back from adversity. Things are going to be challenging, but I have confidence that you can manage. And what are some ways you can do that? And so it's really a shift, and it does go back to those expectations. So if you have something that you're really nervous about, think about what your expectations are for the situation. Think about what you can do if it becomes difficult. We're going to move to the next slide now. And this next slide talks a little bit about what is anxiety. And this, I think most of us generally have an idea of what anxiety is. And in fact, everyone under the sun, every person I've ever met, everyone has experienced the feeling of being anxious. We've all experienced it at some point in time. Everybody on this call can think of something right now that's causing them to be a little anxious. And we're going to spend this next portion talking a little bit about that. I'm going to give an example, and I shared a little bit about this last time I was on the call. When I was in high school, I remember there was a couple things that caused me a great deal of anxiety. And the one that really caused me the most anxiety was public speaking. I would say that I had the worst case of fear and the worst case of public speaking phobia that anyone's ever had in the entire universe. The thought of me even having to present or talk to a large group caused me to feel sick. It caused me to feel like hyperventilating, and it caused me to feel that way weeks before I had to engage in a public speaking event. And in fact, I remember when I was young, I did I was in a theater class. I think I was probably in 5th or 6th grade. And I had a situation which I was totally humiliated and embarrassed. And because that situation happened during a performance, I developed a belief that I just wasn't good at it. And anytime that I would do a public speaking speeches or anything like that, it would go terrible. It would be a nightmare, and I just had no confidence. And because I had no confidence, whenever there was an assignment that involved public speaking, I went right back to, this is going to go horrible. This is going to be terrible. I can't do this. And because that was my mindset, it typically caused me a lot of physical symptoms. And so finally, I got to a place in my life, and this was through some work, where I realized all of that was wasted energy. Because when you're anxious about something, the only way, and anxiety is actually the most treatable disorder there is, the only way to overcome anxiety is by starting to be confident that you can do those things that actually cause you anxiety. So what I had to do is I had to start practicing. I had to, the first part is I had to be realistic with my expectations. I said to myself, I really want to tackle this. I'm going to start practicing, but I have to be realistic that it's not going to go perfect. My first expectation might just be to make it through and to present to a small group. And people may not think it's really good, because it probably won't be, but that's my expectation. But just putting myself out there and practicing, my goal is to get a little bit better each time. And the more I did it, the more I became comfortable with it, to the point where now I could present to thousands of people, and it really doesn't cause me a lot of anxiety. Sometimes a little bit, but for the most part, it's not. And so when we think about the notion of anxiety, and I want us to be mindful that I think we have a tendency to overuse this word. You don't want to go up to a teenager and say, you look so anxious, or your anxiety made you do that. Oh, but he's so anxious, he can't go to school. You want to be mindful not to overuse the word anxiety. Anxiety is a word that talks about something, and we're going to talk a little bit about the brain in a minute too, but it talks about when we're in that emotional state and we experience things like excessive worry, unwanted thoughts. Anxious people don't typically worry something really great is going to happen. When we're experiencing anxiety, we have symptoms, which are our anxious thoughts. That's one of the symptoms. So typically when we're anxious people tend to say things like, this will never work. This is going to be terrible. This is going to be horrible. It's going to be the worst ever. I should have done something different. I'm a terrible driver because I got in one car accident. And I might say something like, this always happens to me, versus being able to take a reality view and I got in one accident. And so we have a lot of unwanted thoughts when we're anxious. Anxiety can cause emotional distress. You will hear me say things like, my job as an anxiety therapist is to teach teenagers, especially, how to be comfortable being uncomfortable. How do we manage our physical symptoms and learn to sit with that? It's interesting, and here's an exercise I do with teenagers. I have them first, and I'll give them a scale sometimes, 1 to 5 rating, and I'll talk about what are their physical symptoms of anxiety. What does a level 1 look like? A 1 might be an anxious thought. 2 might be starting to feel lightheaded, sweaty hands. 3 might be feeling like I'm going to be sick. 4 might be starting to breathe really heavy. And a 5 could be something like hyperventilating, feeling like I'm going to pass out or throw up. And I have teenagers or even adults kind of start to think about their anxiety rating, because when we're anxious, it's all or nothing. It's either I'm doing really great and I can deal with it, or it's the worst ever and it's terrible and it's awful. And so we talk about, okay, what are your physical symptoms? Because oftentimes that's kind of an anxiety level rating. And how do you manage those physical symptoms? Because when we get really, when our body starts to tense up, and this might start with stress, but when your body starts to tense up, it signals to your brain that something's not right. Well, people that have a tendency to be more anxious, that signal triggers that fear, fight or flight. I might be in danger. I might be in danger if I give a speech. I might be in danger if I go back to a situation that's new for me. I might be, and especially during this time of COVID, it's tricky because a lot of our fears, there's evidence for. And so a lot of, especially those individuals that already have anxiety, the anxiety has been heightened because now they might say, well, see, it really isn't safe, or see, and that might trigger more. I'm not saying it's not valid to be worried or anxious, especially during this time. This is more how to move out of the anxious brain into a little bit more of the rational brain is what we're going to talk about. But being in touch with your physical symptoms and being able to first manage those physical symptoms, because when you recognize you're really anxious or heightened emotional state, what you want to do first is you want to learn to calm your body down, because when you calm your body down, your thoughts are going to slow down a little bit. And so that's going to be key. So if you feel like you're really agitated or you're anxious or you're emotional and you're with your teenager, you're probably going to respond out of that versus allowing your body to calm down and providing more of a rational response. If you think about a time that you really reacted out of anxiety or emotion, probably you later kind of looked back and thought, gosh, I could have handled that differently if I was in a little bit more of a calm state. We have actually one of the things, and if you've ever been in anxiety treatment or worked as an anxiety therapist, we do something called interoceptives. And what we do is we have people in our anxiety clinic actually do things that produce physical symptoms of anxiety. They might breathe through a tiny straw. They might shake their head side to side 50 times. They might jump up and down. They do things that cause the physical symptoms. And then we actually teach them how to bring those physical symptoms down. And that's just a whole separate part of treatment, because what we're doing is we're teaching kids in this case how to recognize and respond when they have those symptoms. And so there's a lot of different elements to this, but we want to be in tune with our anxiety. We want to recognize when we're experiencing anxiety. Be mindful again that not everything's anxiety. Sometimes we're sad, sometimes we're angry, sometimes we're frustrated. Sometimes your teenagers just don't want to do something. Sometimes they've learned ways to avoid because it's worked for them. And so if you notice this with your child, just be aware of what's going on. The other piece that we do is when I first meet a teenager, and this is something I'd like you to try tonight. I have them identify all of the situations that cause them to be anxious. I have them identify, all, if it's at school, if it's in their social world, if it's in their home environment, what are all the situations that cause you to be uncomfortable? And you can all probably think about some for your child at home that cause them to be uncomfortable, and maybe write some of those down. Examples could be being the center of attention, asking for help, being criticized, not doing well, being considered, not having friends, entering a new place, entering a crowded space. I have some kids that are uncomfortable and fearful around other people that are sick. They're fearful of getting sick. They're scared of vomit. Littler kids, a lot of times I have, are scared of like storms and heights and bugs. We actually have a virtual reality system that we have the kids use, and it produces situations that create that anxiety, and we walk through it. When we go to the next slide, we talk about some of these situations. So I want this slide for you because I do want you to reflect on situations that cause your child to be uncomfortable. Because what you're going to want to do, and as a parent, and if you do this, it's okay, because we all do this. As parents, generally, we want our kids to be happy. And because we want them to be happy, we tend sometimes as parents to have a hard time when they're anything other than happy. So many parents will tell me, when my child's sad, I quickly try to make them feel better. Or when my child's anxious, I typically try to relieve their anxiety. That's a normal parent response. The problem with that is we have to think about, and when I started this presentation, I talked about how some teenagers don't believe that they can be successful, or they're apprehensive about new situations because they feel like they won't be able to manage. We want our teenagers to start to develop confidence and to start to be in tune with all of their emotions. So I want the clients I work with, I want families that come into my office to learn that they can tolerate feelings of uncomfort. But what happens over time, sometimes we send kids a message that they're supposed to be comfortable all the time. We intervene, we respond, we make them feel better, to the point that we have this pattern where our child really can't meet expectations in multiple places, or they totally fall apart, or they become really, really upset. So I'm going to ask you, how do you typically respond when your child is anxious? How do you, when you notice your child struggling, what is typically your response? Does it raise your anxiety? Does it cause you to feel more anxious? Or are you able to sit with that and allow your child to be in that place? And this is tricky because this may have been going on for a long time. So you might have a situation now where, when there's an expectation, and a parent just shared this with me last week, there was an expectation for the child, and the child who was 15, it was a 15-year-old girl, she ended up crying hysterically and screaming, saying she couldn't do it, and she was isolating in her room. And the parent said to me, she's just too anxious, she can't handle that. Well, what's happened over time is, yes, she's anxious, but also she avoids. And because she avoids and avoids, Now she's not, it's kind of a two-part with this particular young lady. She's definitely anxious, but she's learned to avoid. And the more you avoid something that makes you anxious, we all know it just creates more anxiety. And so we're going to talk about that. But this is going to be key as a parent to be aware of your own anxiety and how you respond when your child starts to struggle. Because, and you'll hear me say this too, it's kind of like if you're on an airplane and there's turbulence, who are you going to look to assess the situation if you're a passenger? You're going to look to the flight attendant and you want them to look calm and neutral. And so often our kids look to us. And when we start to fall apart, or when we start to really, are you okay? Are you okay? Are you sure you can do this? What's wrong? It goes down pretty quickly, and our kids start to struggle even more. And so it's key that we're aware of our own anxiety. And if you're a teacher or an educator, just this is equally as important for you as well, because times are really stressful. And when times are stressful, we have a tendency to be more anxious anyway. Just to be aware, do we reinforce avoidant behavior, or do we maintain expectations? If you have a child that's struggling, it's even more important than ever to have some structure and expectations for them. Three things as we're going to talk about you don't want to do with an anxious child. You don't want to, and I'm going to touch on this in a couple slides, but you don't want to help them avoid things that make them anxious. So when you think about that list of all the areas or all the situations that cause your teenager or child to be anxious, you want to make sure we're putting them in situations where they can learn how to manage. If you notice them doing something different, or you notice them managing, really point that out. Like, hey, I noticed that you tried something new today. Even if it's small successes, try to reinforce when they're doing what they should be, or that desired behavior, versus always focusing on what they're not doing. Expectations such as homework, going to school in person or virtually, chores around the house. I never tell a teenager they have to do something, or I never power struggle with them. I never get into arguments. I simply say it's your choice. And you want to say this especially to somebody with anxiety. You want to avoid a lot of excessive talking, because you can't talk somebody out of anxiety. Say something like, you have a choice. I know this might be challenging for you, but here are your choices. You can either complete your work or you don't, but if you don't complete your work, you're just not going to earn, your privilege of extra electronic time. And this is kind of a really hard conversation to have, especially in this forum, because parents will time and time, they'll say, I can't do that. That's mean. I can't punish my child for being anxious. Kids with anxiety and emotional issues, and I will tell you this, it's been every case I've seen for 25 years, they do better with structure and they do better with consistency. They don't like it, especially at first, but they benefit from. So the kids that I usually typically start working with that have the most anxiety, that really struggle, there's some patterns that have developed over time. We also have, and again, I'm going to touch on those high achieving kids that really struggle. Sometimes those kids, that anxiety comes out of this belief that no matter what I'm going to do, I'm not going to be successful, and I can't tolerate any type of failure. And I work with a lot of, especially athletes around this, college athletes. And one of the things we work on is, how do you bounce back from failure? Because you're going to have to learn to get really good at bouncing back from failure, because it's going to happen all the time. And that's realistic. So be careful as a parent, if you think about those areas that your child struggles in terms of anxiety, not to help them avoid those very things. So when I was younger, I always tried to avoid public speaking. I put it off. And the more I put it off, the more anxious I got. And because this cycle continued, it went on for years and years, until I started to don't try harder, try different, start to do the things that make me anxious, and get confident that I could overcome difficult situations. And this is going to be key for our kids. If there's safety issues involved, if you feel like your child's, there's safety issues, or you feel like your child's not stable, that's different than anxiety. I would definitely encourage seeking help. What we're talking about tonight is anxiety. But if you, and parents, this is a conversation I have a lot also. Parents will say to me, if I limit the cell phone, or if I limit the video games because they're not meeting expectations, then they tell me that they're going to hurt themselves or that they're going to get worse. If that's the case, I would reach out for some help, because that's a little bit of a different situation. One, sometimes it can be the teenager knowing what to say because it's worked in the past. Other times it can be that teenager really needs some different intervention, because if they're not meeting expectations, that can be another story. On the next slide that we look at, and this is what I touched on. If you really want to make somebody anxious and you want to help them to become more and more anxious over time, help them avoid everything that makes them anxious. So anytime you notice your child's about to be anxious, rush in and intervene, take away anything that could possibly cause them to be anxious, and that's going to actually cause them to have more anxiety over time and less confidence. If you want your child to be more anxious, provide lots and lots of reassurance. Tell the child they're going to be fine. Tell the child not to worry about it. Tell the child everything's going to go great because they're so wonderful. It's not realistic. And that too, reassurance will actually cause anxiety to be worse. Again, as parents, we do all these things all the time. With the anxious child, you have to be careful. Instead of telling a child that they're going to be, I just noticed there's misspelling. Instead of telling the child that they're wonderful or going to be amazing, help that child set realistic expectations. Like, here's, these are, or what are areas that you feel like you're really strong in? What are areas you need to work on? It doesn't help a child's confidence to constantly tell them that they're amazing and they're going to rule the world. It helps to really praise them for things that they've done and things they've done well, especially around bouncing back or being able to manage adversity or ask for help even, or use supports. But it's also important to help them acknowledge that it's okay to have areas that you struggle in. I love how you struggled today and you got right back up. I love how you struggled in that class and you weren't able to get the assignment done, but you went right back to it. Sometimes we focus on the wrong areas. And with kids with anxiety, it's about taking a step back and not doing so much talking, but being more purposeful in our responses. Sometimes we try to throw a bunch of distractions in the child's way. And again, that's not always going to be helpful either. I think we have to be careful that avoidance, reassurance, and distraction doesn't always help. What's going to be key, like I talked about previously, is letting that child learn to be comfortable being uncomfortable. In anxiety treatment, we help them to understand their physical symptoms. We help them to understand just different ways, whether it's breathing or mindfulness, sometimes looking at the evidence, fact checking, ways to calm those physical symptoms. I have something I constantly do whenever I'm feeling anxious, or I have a client who's feeling anxious. I have them write down all of their anxious thoughts. And next to each anxious thought, we write one piece of evidence or one fact. So instead of, it's going to be, today was a terrible, awful day, my friend told me she didn't want to be friends with me anymore. Okay, well, let's talk about that. And as parents, and I had this one mom, and she was so great. She said she would pick up, and her child was in 6th grade. She said, it's so hard for me because I'll pick up my child, and this is when school was in session. And she said, I will look at my child's face. And if that child does not look happy, my anxiety goes up, and I right away say, what's wrong? And she said, pretty soon that child, we got in this pattern where this child was hyper focusing on the one thing that maybe didn't go well that day. And then we would spend the whole car ride home talking about what didn't go well. I tend to be a lot more solution focused. I don't talk with people necessarily always about their problems. I talk about the solutions. What can we do differently? Don't try harder, try different. What can we do differently to get a different result? If your child looks sad, maybe they're tired, maybe something did go wrong. Instead of rushing in and saying what's wrong, really kind of say something different. Like, what's one thing that did go well today? And kind of pull them in one thing that really was difficult for you, and help them to see that every day is a day where a lot happens. Tons of things happen every day. Some things go well, some things don't. And how can you manage both of those. And so for us as parents, it's key that we're responsible, or at least in tune with, are our reactions purposeful? If you're a parent, and sometimes anxiety can be genetic. So you might have a really anxious child and you might struggle with anxiety yourself. Uh, there's two types. Sometimes as parents, when we're anxious, we do a lot of talking. Sometimes we even yell or we get in power struggles because we're so concerned or anxious. Avoid a lot of talking. Your kids typically can only hear a couple words. I think sometimes we have a tendency to go on and on and on, but just be mindful of what is the purpose of that dialogue. And I think that that's going to be something to think about. And if you're one that struggles just connecting with your teenager, possibly you really don't know what to say, it's okay just to listen, and it's okay, just to be present. I like this question. What would you say are the key differences between anxiety and worry? There's definitely a lot of similarities. I think worry can be exhausting. Worry is when, like, if I'm really nervous about a meeting I have tomorrow morning, I might have a lot of worry thoughts, or I might get really worried. And like I shared earlier, um, you know, people that are worrying are not typically worrying that everything's going to go really well. Sometimes we might have something realistic to worry about that can cause us anxiety. Most of the clients I work with, their anxieties are not always rational based or realistic. So sometimes worries are like, I'm really worried I'm going to lose my job, or I'm really worried that I'm going to lose my house, or I'm worried that my marriage isn't going to stay together. A lot of the teenagers, the anxiety that they experience or the things that they're anxious about are not realistic. I'm really anxious that if I go to school tomorrow, I don't do well on this test. I'm not going to get into a good college and I'm not going to be successful. I'm really, really anxious if I go into this class, everybody's going to be looking at me. Everybody's going to be staring at me. When we know that's not always true. I spend a lot of time with teenagers doing reality checks too. We're going to get a little bit into exposure therapy and what exposure therapy means. And we use, it's a type of treatment that we use along with cognitive behavior therapy to treat anxiety. If you have a child that has anxiety and you take them to a therapist that doesn't really know about anxiety, you're probably going to notice it's not necessarily going to make a huge impact. Sometimes anxiety can be treated with and depression with medication. I could say only sometimes. Some teenagers, they do get put on medication for anxiety and depression, but that's not always the case. Typically in the clinic, we treat anxiety without medication using exposure therapy and cognitive behavior therapy. On the next slide, and these are skills. I created one of the anxiety programs at Amita Health. And when I shared some of this last time, but when I created the program for the teenagers that had anxiety, these were the different things that I was working on. I wanted the teenagers in the program and the parents to learn how to manage feelings of discomfort. Physical symptoms can be very, very uncomfortable, but there's usually a beginning, middle, and an end. Most people have what's called anticipatory anxiety, where they're really, really anxious before they do the thing that makes them anxious. And then once they do it, the anxiety might be heightened in the beginning, but then after they're done, it goes down. And every time you do the thing that makes you anxious, it goes down a little bit more to pretty soon your anxiety levels are pretty low. And managing feelings of discomfort is going to be huge. There's actually what some doctors use, especially for individuals that have performance anxiety. They do this sometimes with even doctors. They do this with professionals that have huge phobias of public speaking. Sometimes doctors will use what's called a beta blocker, such as Inderal, because what the beta blocker does ultimately is it lowers the physical symptoms. So let's say you're an adult and you're terrified of heights, or you're terrified of, let's say, speeches. You might use a beta blocker while you're practicing the exposure because it brings your physical symptoms down. and then you feel like you can tackle it. And that's in rare cases. That is used sometimes. I'm not a big fan of things like Xanax and Klonopin and other benzos to deal with physical symptoms, especially in teenagers, because it can be so addictive. The next thing that we use a lot is teaching, especially our teenagers, make sure your child at home knows how to communicate what he or she needs. Make sure that they know how to ask for help. And keep in mind, because the teenage brain is still forming and they're growing, their needs are going to change. And they may say something right now, but it might change in an hour. So try to be mindful when they're communicating to just do an overall assessment. Don't panic or assume right away. Try to kind of take a larger picture of what's going on. Helping teenagers increase problem-solving skills. If there's a problem in front of them, how do they tackle it? Do they throw their hands up and say it's not going to work? Or are they able to say, okay, I tried this last time, that didn't work, I need to try something different? These three areas can be great if we can model as parents. And again, I'll say, as a parent, I struggle with all three areas because it's hard, right? These are difficult because we do care so much for our kids and we want them to be okay. I don't want anyone to leave here tonight and feel like, or listen to this recording and feel like, wow, I'm doing everything wrong. As parents, we're going to make millions of mistakes and we're going to do millions of things well. Our kids are going to rebound. These are just some things for you to think about tonight. But model, hey, gosh, I did this thing that caused me to be really anxious, and I had these physical symptoms that kind of got better when I put myself in that situation. Has that happened for you? Who can you ask for if you go to school and you're having a really hard time? Maybe you're going back to in person next week. Who can you ask, or what can you do if you feel like you need something? I can't tell you how many teenagers, especially virtually, are having a hard time asking for help. There's some great opportunities for us to help our teenagers gain some skills. Increasing problem-solving skills. Again, like, when you see them struggling, hey, have you been in a similar situation before and how did you deal with it? What's another way that you could possibly tackle this problem? I think this is key. And again, if you're thinking about your child going to a job or college following high school, it's important that they are really key in these three areas. I, as a clinician myself and my staff at the center, we focus on these three areas with our teenagers, because if they don't have these skills when they leave high school, they're going to have a harder time, because as we all know, more and more challenges are going to come. And so our kids need to be able to have these different areas. When we look at the next slide, we're going to move into helping our teenagers build resiliency through this, through dealing with anxiety. And again, we all have situations that cause us to be anxious. Anxiety untreated can oftentimes lead to depression, because you start to get down on yourself. You start to believe, like, I can't handle situations. You start to doubt yourself. Over time, that really can lead to depression. And plus, anxiety is exhausting. Anxiety is exhausting, but so is excessive stress. And so if you're under, as I started the presentation, if you're under extreme amounts of stress, well, then you can say to yourself, it makes sense that I'm feeling more anxious. It makes sense that this is my body's response, because you will have physical symptoms of anxiety, but prolonged stress, untreated stress, and even trauma will weigh down your body so much that it will then produce those anxious feelings, which will lead to anxiety. And so make sure that you are taking care of yourselves and engaging in that self-care piece. You can't always control your stress. Many of us have stress right now that the stress is just there and there's nothing we can do about it. Try to work with somebody or work with somebody close to you on ways you can manage that stress in a healthy way, putting things into perspective, being kind to yourself. You don't want to ever say something to yourself that you wouldn't say to somebody else. So if you feel like you're not doing a good job, we can get really critical of ourselves. And I say this to teenagers: would you say it to somebody else? Well, if you wouldn't, and if your response is, no, that would be too mean, then you have no business saying it to yourself. this is a time where we have to be kind to ourselves. If somebody around you is kind of behaving in a way or saying or doing something that's alarming, kind of put it in perspective. People are saying and doing all kinds of stuff right now out of their own emotional responses. I think we just all have to be kind and set boundaries when need be. Our teenagers need to know that they're allowed to have emotions and that emotions are going to change all the time. We want to hold them accountable. Obviously, you never want to have, and I've seen this before, a teenager screaming or yelling or throwing stuff and saying, well, they're just anxious, they couldn't control it. You need to have some structure around that. Again, we don't, it can be just having those expectations in the house. If you're experiencing anxiety, we do expect that there are some ways that you would manage that. And if you're throwing something at me, there are going to be consequences, even if you're anxious. And think about kind of how they would be held accountable at school. Teenagers do better when they understand what's expected of them. As parents, when we become anxious, we have a tendency to excuse a lot and think it's helping when really it kind of, you'll notice, makes things worse. Allow them to know it's okay to be sad. How do you feel about what's going on? And really listen to them and listen to what they're saying, because it's important that they are able to get out when they need to. And we don't always have to have a response to it. Sometimes they can talk about how they're feeling and we can just listen. We don't have to say anything. Work on connecting. Our teenagers, more than ever, they need us. They need us at home, and we do have those rare moments to be together without being on our electronics, but just be together. Try to find that. Your teenager may not want to hang out with you, but they need some time with you. If something that you're doing isn't working, try something different, because they do need us. Be mindful of your reactions. What are you responding to? If you're really frustrated, think about ways that you're communicating that to them. Just be mindful of your reactions. As parents, we have a tendency, because we're so passionate about our kids, sometimes we can say some really, really hurtful things. I've heard, and I've said things that are really hurtful. We find ourselves, well, if you want to be successful, you'll do this. You're never going to be able to do that. Or this is never going to work. Our kids are going to mirror our attitudes. So whatever your attitude is right now, kind of about their situation, be careful that it's not projecting onto them. And how do we teach healthy coping? How do we cope in healthy ways? Because again, and I shared this last time, I have 2 adult children now, and I taught them a lot of really great things, but I'm not sure how much they listen, but they both act just like me in a lot of ways. Our kids are watching us, and the way to teach a lot of these great lessons is by practicing them ourselves. And again, we're not perfect. If we can even start in one small area and acknowledge to our kids that we're not perfect. I struggle with this. This is hard for me, and this is something I'm working on too. On the next slide, and we have a couple more. Just being purposeful. Think about some goals you have tonight. What are some things that you want to teach your teenagers through your parenting? What are a couple things that you really, really want to work on with your child? Maybe you want your child to be more confident. Maybe you want your child to in their mind say, wow, I can deal with new situations. I might be apprehensive, but I know I'm going to be able to manage it. Think about your goals, and then start to think about if your reactions really are in line with those goals. Are you modeling those key things that you want your teen to be picking up on? If you find that, gosh, my teen really doesn't express anger well, but then you reflect and you're like, gosh, I yell a lot. Well, there you go. There's a great place to start. If you recognize, gosh, my teenager is always so anxious, think about how you as a parent, how do you model when you're uncomfortable or you're anxious? Do you send a ton of emails? Do you kind of move into the sky's falling, everything's terrible and awful, which we call black and white thinking? Or are you able to put things into a little bit of perspective? This is a really difficult situation, but I've gone through a lot of difficult situations in my life. I know I can ask for help. I know even though it seems difficult, once it starts, it'll be okay. It's kind of like I have this joke. every morning when I'm lying in bed, I'm thinking, oh, it's going to be I try to exercise in the morning. I think it's going to be a terrible workout. I don't want to go. It's going to be awful. But then in my head, I know if I get out of my head and I just focus on behaving my way into feeling different and I just go through the steps, it'll be fine once I get there. Sometimes it's about putting it in perspective. Grab onto whatever self-care you can right now. You got to make time for yourself. Take breaks during the day. Focus on breathing, and I work on this a lot with teenagers. With self-care, if your teenager is working on coping skills, or it takes practice, whatever you're trying to do. So if someone's anxious, I can't cure their anxiety. In fact, we want some anxiety. I want the clients I work with to understand some anxiety is actually good and it's key for performance. It's about learning to manage it. But when we're working on our self-care and we're practicing that self-care piece, it's going to take practice and it's going to take time. If I'm working on deep breathing strategies, it's going to take a good 2 minutes of me just focusing on breathing to bring my physical symptoms down. If I'm focusing on muscle relaxation, 2 to 5 minutes to see any kind of a change. Often teenagers, they're so quick, they try a coping strategy once for 3 seconds and they say that didn't work. It's about allowing them that space. I'm going to add this too, if you're super emotional or your child's emotional, try not to engage in a lot of conversation when one person is emotional. Allow that person to calm, or you calm yourself. And if it's your teen, you might just want to say something like, you seem really upset. I'm going to give you a couple minutes to calm yourself down and we can have this conversation. They may get mad, but those couple minutes will be key in that interaction. On the next slide, and again, these are just some strategies, and we've covered a lot of these tonight. Be aware of those areas that trigger anxiety in you as a parent. Just be aware. Know those areas that trigger anxiety and work on yourself and being a little bit more purposeful. The best thing I did as a parent, and over I had to practice just taking a step back and asking myself, is this more about me and what's going on here? Or is this about kind of what I'm trying to do as a parent? 90% of the time I had to walk away. We talked about setting some goals tonight. Creating structure, and I know this is key. Kids that are struggling emotionally, so often, we worry and we feel sorry for them, so we take off the expectations and the structure. Especially right now in this time of uncertainty, our kids need that structure to feel safe. They won't always tell you they want it. Consistent expectations and follow through, whether or not they're having anxiety or not, holding those expectations. Kids that are more prone to anxiety or ADHD are more prone to electronic addiction. You got to be careful about that in terms of video games and excessive cell phone use. When you try to set some expectations around that, you might notice some kids even become violent or become self-defeating. And that's important to reach out for help, but you're still going to want to set some limits around that. Communicating effectively and recognizing patterns. If something in your home isn't working, don't try harder, try different, take a different approach. Think about kind of how you're responding, and if it's not working, come up with something else. But know whenever you do something different, it's going to take about 2 weeks of consistency to see any change in the child's behavior. So don't despair. It might get worse before it gets better, but focus on your goals. And when you get really frustrated or worried, take a step back. If there's ever any concern about that child in terms of any self-harm, obviously depression or prolonged anxiety, get help. But typically when part of that help at the hospital setting, reason kids come to the hospital, and one of my jobs is Amita Health, they come because they need so much structure and consistency that sometimes the homes can't give, that we put them in that structure to help them kind of bounce back. And then on the next slide, here's just some coping strategies and some different things that you can practice with your child or for yourself. There's lots of apps today. There's an app called Calm. There's many apps out there that just kind of cue you into the mindfulness and the breathing piece. There's grounding techniques. We teach individuals to think about their five senses while they're breathing and just kind of focus on being present. Again, anxious thoughts are symptoms of anxiety, or likewise, when we're really depressed, our thoughts are going to be a symptom of that, most likely. Kind of recognizing, letting the thoughts pass and focusing on being in the moment with those five senses, breathing and relaxation, and also changing the way you behave is going to change the way you feel. So if you're feeling really depressed and you're staying in bed all day, you're going to feel worse. You might want to kind of come up with a schedule, and you're going to have to fake it till you make it and behave your way into feeling different. And that really is true. And I think we have one more slide, and I'm sorry I'm taking you guys right up to the hour. That is me. I know I talked and gave a lot of information. There's a lot of research out there to kind of confer with what I'm talking about tonight. I didn't say anything that really isn't kind of from my experience, and it's been pretty consistent. With that being said, every child's different. Every child learns at a different rate and a different pace. Everything I said tonight may not fit for you and your situation and your family. Hopefully I said a couple tips that can be helpful. If there's information that wasn't helpful, definitely leave that behind. This is just really about just trying to provide some different things. So hopefully that brings us up to 8 o'clock, and I'm going to, Mr. Klett, open it up if there's any questions or if you had any last words.
Yes, does anybody have any questions? You can either turn your mic on or put them in the chat if you'd like. Oh, there's one there, Jackie.
Yep. No, when we talk about, and I know like when we talk about anything that you're going to do, especially with performance, we want to have that heightened state of anxiety, not so much worry. Like when I think about worry, like if I think about this is a stupid example, but like if I'm going to run a race or something like that, I might be really nervous, have that kind of almost like feeling of an excitement before I'm about to go. What you don't want to go into it becoming so much that those physical symptoms are ramping up. Sometimes people will even have like panic-like symptoms, panic attacks before they're about to do a performance. Worry, yes, definitely worry can be part of it too. Some kids have what we call negative self-defeating thoughts, where they really tend to worry, I'm going to fall apart, I'm not going to do well, this is going to be terrible, this is going to be awful. They'll have those kind of worry type or anxious thoughts. But some anxiety is good for performance. And when we're doing, as we talked about earlier, those physical symptoms, I'll go back to that physical chart and talk to kids about, you want to be at like a 1 or 2 anxiety on that physical chart. Some of that anxiety is actually good for performance, and that gets you ramped up and that gets you excited. We don't want to have 0, but yeah, it's setting those realistic expectations. We don't want kids to ever think, if I make a mistake, I'm a complete failure, I'm going to flop, this is going to be terrible, this is going to be awful. All those kind of catastrophic thoughts we want to avoid.
Hi, Jackie. This is Carrie here. I just had a question. I'm sure you have been updated, but this junior class has been through a lot since they've been in 8th grade. They've lost a peer, a student, friend. Some of these kids have gone to preschool together. Mm-hmm. All of our lives are intertwined with each other. And they've lost this student due to suicide, okay? And so sometimes anxiety comes out in the fact that they're worried about who's next, right? I mean, just this week, a student came really close, and I thank God that for the positive energy around that didn't happen this week. But what is the best way to navigate? I mean, you're talking about years. I mean, it's from 8th grade to junior year over and over again. And these kids, I mean, it's hard. It's very difficult for them, and it's difficult as a family to watch this and also figure out what is the best way to support them through this experience, and to see the light at the end of the tunnel. That I mean, for a child to experience that many deaths, it's not easy. I mean, even as an adult, I never experienced that many tragedies. So, I mean, I don't know if you're going to be doing future workshops for the families on this, or maybe you can answer that tonight. I know it's a big question. And also, I'd like to thank all the staff for coming back the next day and having to teach our kids, because I know I'm a kindergarten teacher, and to lose a student and to come back into the classroom the following day, even that may have been your student, right? I mean, that's remarkable. So I am very grateful for an amazing job that Wakanda has done to pull it together and be there for the kids. But maybe you can help me out with that.
Yeah, I mean, that's not, there's a lot there. And I actually we talked about this a little bit in the first session. I've worked in the hospital, inpatient and partial. I've worked in psychiatric for 25 years with teenagers with self-harm and suicide ideation. So this is, definitely in my wheelhouse. And a lot of, I mean, I hate to say it, but I can't answer this in like 5 minutes. As you know, this is a loaded topic. But I think more now than ever as parents, and I say, we have to really, be there for our kids at home and listen. And again, understand that, and I've done a lot of research on this myself, and I've actually had a lot of practice in this. When we just have to be careful that we're separating what we're experiencing from what they're experiencing, and really being present with them and listening. Because so often teenagers tell me that they're confused even understanding what they're experiencing because it's kind of projected on. And so I think now more than ever, we need to make sure we're really being aware of ourselves and what we're dealing with. Like you said, it's impacting us as parents, being aware of that and separating that out, really focusing on the self-care for us, and then really working on connecting and being there for our kids and asking them how they're feeling and what they're thinking about and what's going on for them. And that's going to be key. And really, again, when kids are dealing with this, I'm sure many of you know that are in this field too, that when our kids are dealing with grief and just uncertainty, they need us, and they also need that kind of structure in place to make them feel safe. And so in so many ways, and I work with a lot of families that have experienced trauma, in so many ways, when we're dealing with really difficult times, we need to come together as you all have come as a community. And so I would love to do, I would do parent groups every week. I mean, I do them every week because I love, I wrote a parenting book last year because my passion is families and parents, and it has been for 25 years. So anything I can ever do to be of assistance. I partner with your school district. I have for 10 years in different events. I don't work for your school district, so I can't speak to everything that's within the district, obviously, but I'm very happy to be here tonight, and I want to be a support. And if you guys ever need anything, you can always let me know.
Any other questions? Well, Jackie, thank you very much. Really appreciate you taking the time to speak to our parents. And we know you put a lot of work and effort into this as well, and I'm sure it's beneficial for everyone. Thank you, everybody, for attending tonight, and have a great evening and have a great weekend. Thanks.
Thank you.